Hi, it's Aaron with Diabetes. Diabetic Aaron here. I'm going to show you what I do to stay healthy. I use an insulin pump like this. This is produced by Medtronic. In that I use Novolog that comes in a bottle like this. It's insulin, but it's a fast-acting insulin. So it's fast enough to handle the high glycemic index foods, which is very nice because now I have a lot of flexibility in my diet. I can literally eat anything. I simply have to time the dose to how quickly the food I'm going to eat is going to go into my bloodstream. So that is difficult. And that is why some people choose to stick with the high protein diet. A high protein diet is something I used as my treatment, which is has long been the treatment for diabetes, because sugar raises the blood sugar. With the insulin pump and the Novolog, the fast-acting insulin, and this is not regular insulin. There used to be regular and NPH. Regular was the fast insulin. It has 4 molecules of insulin combined together in the solution. This new type of insulin has 2 molecules of insulin, so it breaks up faster. And there are graphs as to how the insulin enters the system where it's used by the cells. Interestingly, weight trainers that want to really bulk up big muscles now use insulin because it does open the cells up to the food. Insulin is the cause of this belly fat, so I'm told by some physicians. It is insulin that causes the belly fat, which is dangerous to the health. It's one of the signs of, I think, heart disease if the belly is over a certain size. So those are the primary things I use. I always keep handy some syringes because this is the backup. Of course, years ago, one had to sharpen their syringe so that they could use it again and then boil them. These are disposable, but they can be used many times. This is a type of syringe. It's called a, a reservoir. This holds 30 milliliters, whereas one of these holds half a milliliter. Normally when I take insulin, I don't fill the whole thing. I usually would fill 10 or so. The way that's calculated is with the insulin pump. My doctor has put in, this is the insulin pump that I use. My doctor has put in what they call an insulin to carb ratio. So when I say I'm going to eat a piece of bread, 15 grams of carbohydrates, or 1 carb exchange, but the insulin to carb ratio uses the grams of carbohydrate. And if you notice on the food labels, you will always see carbohydrates and how many grams, fats and how many grams, and proteins and how many grams. It's long been held that insulin is not required to digest protein, but I believe that that is now incorrect. Now the weight trainers say they use insulin and it bulks up their muscle tissue. The amino acids are, with insulin, able to go into the cells and make them grow larger. So I don't know if that protein, it does funny things. If it can't go into the cells to make them larger, and we used to say, well, that's from eating too much protein, then it does get converted into fat. To clean, this is the best thing to use. This is what surgeons use before they go into a surgery. You need to use not too much of this, as little as possible. It really takes the dirt off, and use hot water. Then it's nice to have a barrier layer. Some people use the IV3000 over the top of everything, but underneath there's a product that I haven't used by Johnson & Johnson, some kind of tough skin or something like that. And this is a liquid adhesive called Skin Tack, and that also makes a kind of a barrier on your skin. Makes it very sticky. Why do I want to make my skin sticky? Well, when I use this goes into something that looks like this. Can you see how these join? I fill this with 3 milliliters of insulin, and this bottle, by the way, holds 10 milliliters. This is a 10 milliliter bottle, so I could fill all of these syringes twice with this bottle. Or I could fill 3 of these and have 6 syringes full left over. One thing that's really nice now is the continuous glucose monitor. This shows what my blood sugar is every hour, every 5 minutes. It takes a blood reading, and so it shows me a graph. Each dot on this graph is a indication of what my blood sugar is. The current number is 217, but if I look down the graph, I can see that a little while ago I was about 100, and I started rising after that. And when it hit that yellow area, 200, and I can set that yellow area to wherever I want. They recommend when you start using one of these to set it up maybe 300, so you don't really have to do anything. You have to just get used to it first. But now when I hear this ringing, it's a distinctive ring, beep, beep, two beeps, I know that I need to take some insulin, because I don't ever want my blood sugar to go over 200. If it beeps 3 times, it means it went too low, and I don't ever want it to go below 70, because I start to have symptoms. So I have it alarm me when it hits 80, just to give me a safety margin. I also have it alarm me when the graph is going down. So like in 5 minutes, if it goes down 20 points, and it's measured in milligrams of glucose per deciliter of blood. And if that goes down 10 points, or 20 points in 5 minutes, then it alarms me. And sometimes I need to do something. Sometimes it's a wait and see. I could also have it alarm me on the rising, if it's rising that quickly, but there's usually nothing I can do about that because that comes from eating a high glycemic index food, like a watermelon, for example, and not having the insulin at its peak. So I can go into more about that. Anyway, so I was saying how these two combine together. The insulin goes in here, and then this is what gets put into my skin. And this can stay for a week, and 3 days is what's recommended because of bacterial growth. There's a lot of graphs with these medical things. Bacteria grows exponentially, and there's mathematics involved, but basically what it does is it goes like this. The curve is like this, and then it kind of straightens out going up. So you don't want a lot of bacteria, but for the first 3 days it's kind of in this mode where the bacteria is increasing, but it's not linearly. It would be a straight line. It just keeps increasing at the same speed. That's a linear graph. An exponential graph is where it's going really slow at the beginning, but then it kind of takes this turn and goes up. And they say at 3 days is when you should change that. And if the weather is hot, I think we need to change it more frequently. So this goes into my skin and it sticks. There's tape on there. When it's humid and I'm sweating a lot from my work or exercise, I need to use the skin tack to keep this on. And this works very good. This is another must-have for every diabetic. This are glucose tablets. I also like the gels and the liquids, but it's glucose. Now you can find candy if you look at the ingredients. We see the ingredients on here is dextrose. And you can look at some candy and look for the ingredient dextrose. And that will do the same thing as this, unless there is dextrose and, well, look at this. This has hydrogenated cottonseed oil as the second ingredient. I was going to say you need to find something that doesn't have oil or fat in it. But as it's the second ingredient, it must be a very small amount and simply for the holding together. The other important item is the blood test. These have become very easy to use. These clickers, they click on your finger and cause blood. Now you should know that the side of your finger has less nerves than the front of your finger. So I always click on the side of my finger. And when I'm testing my blood sugar a lot, it will be all scarred up, and I'll just use 1 or 2. They become numb, but then after a while they become almost calloused and it becomes hard. But those recover quickly. So anyway, these are very easy to use. These strips, I just drop them in here. I leave them in, I don't pull them out. The thing turns off automatically. It's just simplifications after so many years of doing this. These, you put a little tiny drop of blood next to this, next to the end, and the end sucks it up. Now, it used to be that we had to put on a great big drop of blood on this big reagent strip, and then we had to have water in a kind of a specific baby bottle, like a doll baby bottle, that would squirt at a specific spray hardness and wipe off in a 5-minute operation, or 5-second. So take 5 seconds to get all of the blood off, and then pat it dry, and then it has a color, and that color indicates how many or what the blood sugar level is. And there was also a machine you could put it in that would, based on that color, it would give you an actual number. And those were good, but they were not very convenient. Now this, I can take a blood test and people won't even notice sometimes. But that's why this is so much better. I just take this out of my pocket and press the button and look at it. And it not only tells me what my blood sugar is right now, but it tells me what it's been. So I don't have to keep notes and check my notebook and calculate all these things. This device helps us to not have to remember so much. If I remember to look at this every hour, then I will be on top of my blood sugars. It used to be that you could never get on top of, you could never really control your blood sugar. The only thing you could do was do exactly what you did yesterday, and you knew what happened yesterday to your blood sugar. And that was really all we had until the blood tests came along. And so this is a must-have. Here's another must-have, the Glucagon emergency kit. Now, Glucagon is a powder. Here's a powder. And it's in a powder form because once water is put in it, so it's a solution, it deteriorates. It won't last longer than 1 day. So this comes in a kit with a syringe full of sterile water that you have to squeeze into this, and then once you do that, you have 1 day to use this. So it's usually just used immediately. However, if you are running a marathon, this would be a very good thing to have ready. The glucose tablets and the glucose gels and the glucose liquids are good, but I find that when I'm running, my blood sugar does not come up, and this is what a lot of people find. I have to take the gel or glucose tablets, whatever I have that's glucose or dextrose, and sit and wait until my blood sugar comes up. This obviously has more to it. This is just the receiver. There's no real brains in this. What the brains is in this. This little device here. Well, it's bigger than the United States competition. The United States competition looks like this. So we can see the size difference. This is flatter, so it won't stand out quite so much as this one does. You can see this one I'm wearing, and you can see how it kind of distends my my clothing here. So a lot of women like to put this on their arm. It's recommended only for the belly. I guess that's where the FDA approved it. I don't use this one anymore. It's very important to be sure of my readings on here, because if I can't trust it, then I can't act on the information that I have. If I can trust it, fully and completely trust that these numbers are correct, and the graph is correct, it's showing me if my blood sugar is going up or down, then I can take immediate action. And if I look at this every hour, I will be able to correct before I have a problem. Sometimes I'll be kind of leveled out at 200, so it'll ring, and then I'll just know to ignore it, or I will ignore it. And often, of course, sometimes I keep it in my pocket and I don't hear it. And if I'm doing something unusual, like eating a new kind of food, or experiencing some change in my exercise routine, then I can't predict my blood sugar. And that's why that was always avoided by diabetics. But with this, I do have the freedom to live a completely normal life. So that was the brains of it, but of course something has to go in the skin, and this is another reason for the HibiCleanse and the possible use of skin tack. This sticks very well for me, so I've not needed to use skin tack on it. But everybody's skin is different. So this is kind of a push-on device, and it pushes it into your skin, a really fine kind of like stiff hair. You don't even feel it. And then the brains of the operation, the brains goes on top of that, and it clicks into place. And that's everything for diabetes. I hope this talk helped you, and good luck with your blood sugar, your glucose control. I hope you are able to get these set of tools I've shown you prescribed. They're essential for living a normal life with diabetes. Thank you for watching.